The next person I want to introduce, she's one of those sort of movers and shakers behind the scene, and she's also been very instrumental with Nikki and the Greater Detroit Area Health Council and putting this presentation together for the last 5 years. It was something I think that she and GDAC says, hey, this is something we need to do. This is something that's impacted our community. And if you know this person, you know if she gets her hold of something that she wants to do, it definitely gets done. So I want to bring to our stage, or to our studio, I'm in the studio, Darlene Owens. Darlene is the director of a substance use disorders initiatives for the Detroit Wayne Mental Health. Now, for the Detroit Integrated Health Network. We got to update this. Ms. Owens' responsibility is to ensure the delivery of substance use prevention, treatment, and recovery services in the Detroit-Wayne County area. She ensures that our network meets all contractual requirements, the services are consumer and community focused, are aligned with best practice and evidence-based methodology, and are data-driven. She oversees a network of 77 providers that provide prevention, early intervention, treatment and recovery services with over 125 different locations to the residents of Wayne County. She maintains a working knowledge of all relevant state, federal, and local legislation and policies related to the successful operation of the authority. Her educational background includes being a licensed social worker with the state of Michigan, a certified addiction drug counselor, qualified mental health professional, substance abuse treatment specialist, and notary public, and a certified human resource generalist. Credentials include a BA in clinical psychology, yay, and a master's degree in business administration and healthcare management. Her professional career spans over 29 years in the business of human services and 23 of those years in administration. I have the privilege of working with Darlene, and I sort of see her as one of my kids that I worked with and just sort of watched her career bloom and watch her passion for what she does just grow. So without further ado, Miss Darlene Owens.
Hi, everyone. Hey. All right. Thank you, Dr. Dudley. That was beautiful. Wow. I want to get to know her. But anyway, let's get started. There's been a lot of talk today about substance use and its continued prevalence. We've also discussed many resources and ways to reach out to those that need help. Let's talk a minute about our first responders and how they are out there saving lives each and every day. As you may know, Detroit Wayne has trained over 1,000 people on the proper use of Narcan, which reverses an opiate overdose. Today, we would like to recognize the Lincoln Park Police Department for its efforts in saving almost 30 lives with Narcan this past year. Thank you and congratulations. Now, here are a few words from Lincoln Park Police Chief Ray Watters, who received the Colin Rose Award on behalf of the department. Please watch this footage. Thank you, everyone.
On behalf of the Lincoln Park Police Department, I thank you, and I thank you for our officers and all their hard work. We appreciate your this award today. Our number one goal is always to make sure that the Lincoln Park citizens are safe, and part of this this disease has hit our city very hard, and we appreciate your acknowledging their hard work. And this award just proves their dedication, that they go above and beyond to help our citizens. Thank you very much.
Thank you again. Dr. Dudley will now close us out. I hope to see all of you tomorrow.
Congratulations, Lincoln Park. Oh my God, this is amazing. We are so excited about that. Detroit Wayne Integrated Health Network also funds other organizations to provide Narcan training. So there are thousands and thousands upon trainings that are out there, and we are still doing it, and we have jumped to a virtual platform. So there are no excuses. We want to make sure that everybody has access. Our takeaways today are enormous. The one big takeaway is advocacy. advocacy for resources to make sure that we have the appropriate resources to do the jobs that we need to do. Innovation, creativity, you've heard about that, Mr. Dewberry and others. We have data. We are working on data-driven information to help us then to plan and to do the kinds of things that we need to do. We also are encouraging all of us to talk to ourselves and also to the constituents that we serve to become partners in their own health care, to talk to their doctors, to ask those questions. Is there an alternative to these opioids that I could take? And that's something that we'll hear a little bit about tomorrow as well. So we thank you for joining us today. We thank you for being part of this from 8 o'clock this morning, that you were in our booths, that were networking with some of our sponsors. And we want to remind you that tomorrow we're going to start at 8 o'clock. So you can't be fooling around out there in the visual booths, because we're going to be on and we're going to start this presentation at 8 o'clock tomorrow morning. We want to thank you for being here, and we got more information. We've got awesome presentations tomorrow that you don't want to miss. So I will see you tomorrow morning at 8 o'clock. Thank you for being here, and thank you, everybody, for helping put this on. I'm in the studio of Motown Virtual Digital, and we want to thank them for all the help that they have done to make this a success. So see you tomorrow morning.